Let's talk about some timing issues that are very important for vitamin D. Getting vitamin D right it provides a huge advantage in so many aspects of health, but it takes on heightened importance during this pandemic because vitamin D determines your level of T cell immunity. And it's T cell immunity that's very important in your resistance against respiratory viruses. So getting it right, very, very important, especially now. So let's say you're just starting out with your vitamin D and you choose to take the average dose for an adult. That is the average dose I advocate that allows you to achieve a 25-hydroxy vitamin D blood level of 60 to 70 nanograms per milliliter. That's what I aim for. So let's say you start 6,000 units. If you want to check a blood level to see if you've achieved that target, when should you do it? You have to wait at least 2.5 months. So wait about almost 3 months before you check it. So if you're starting on July 1st, you shouldn't have it checked till what? July, August, September, right? Mid-September or even later. Because it takes 2.5 months for the blood level to plateau. So what if you checked it after 2 weeks, or your doctor didn't know and checked it after 2 weeks? Well, let's say you started at a level of 15 nanograms per milliliter, and we're aiming for 60 to 70, remember? And you check it after 2 weeks, it might only be 28 or 33. It's going to look like you're not taking enough. And then you'll up the dose and you may go overboard, right? So you want to wait that 2.5 to 3 months after you start. So very important. What if you're just starting out now in the midst of a pandemic and you want to get up to speed as fast as possible and don't want to wait till mid-September to have a fully beneficial level? Well, you can load yourself up. Some people take 20,000 units for about a week and then go back down to what you believe your chronic dose should be. So let's say you take 20,000 units per day for about 7 days or so, then going back down to, say, 6,000 units per day. But you still want to wait that 2.5 months before you check a blood level. But that's how to get the blood levels up a little faster. Another issue about timing with vitamin D is if there's a dose adjustment required. Let's say, once again, you started a level of 12 nanograms per milliliter. And so you put yourself on 10,000 units. You wait 2.5 months, right? And your level is 48. Well, you should be on a higher dose, maybe 14,000 units. So you increase the dose. And once again, you want to check a level. You don't have to, but if you wanted to, once again, wait 2.5 to 3 months. Okay, so when you start out with vitamin D, wait 2.5, 3 months before you check a level. If there's a dose change, up or down, either way, you want to once again wait 2.5 to 3 months before you check that blood level. Should you seasonally adjust? I hear this a lot. People say, you know what, I'm going to stop my vitamin D for the summertime because I'm outside all the time. Well, I've checked blood levels of 25-hydroxy vitamin D in many people in summertime, a hot summer, and they still are deficient. And you can live in Miami, you can live in Honolulu, and you can still be deficient. There's a variety of reasons for that. One reason is people tend to wear clothes outside, right? Clothes cover a lot of surface area. 2, many people work indoors, work or school much of the day. 3, if you're 40 years old or older, you've lost much of the ability to activate vitamin D in the skin. So you can spend lots of time outside, but you may not be activating vitamin D. And so it really helps to get that blood level once again. Now, if you think you might want to seasonally adjust your dose, do it like this. So let's say check a level in the winter, typically about 2.5 to 3 months into winter. And let's say on 8,000 units per day, your blood level is 63 nanograms per milliliter. Good dose, right? Once again, in summertime, you're getting a lot of sun, wait a couple of months at least into summer, and then check a level. And let's say it's 98, higher than it needs to be. On your, let's say, 8,000 units a day, you can reduce it to maybe 4,000 or 5,000 during the summer. But as soon as you stop getting sun, you want to start thinking about increasing the dose once again. So, but I'll tell you, most people don't have to do that if you're 40 and over. Younger people more so, but if you're 40 and over, it really helps to get it at least once or twice in your lifetime. Do that kind of seasonal twice a year check to see if you need to seasonally adjust your dose. Now remember, there's some other timing issues. It's also helpful to take your oil-based gel caps in the morning because many people get wakefulness from their vitamin D. And so if you take it at bedtime, it kind of can keep you awake. So most people feel better taking it in the morning, and thereby it's not disrupting your sleep. Now remember, I advocate use of oil-based gel caps because those are very reliably absorbed. If you start at, let's say, a level of 12 nanograms per milliliter, you take, let's say, 12,000 units of vitamin D, and it gets you to, say, 73. Right? Stay there. What if you take tablets? I've seen this happen hundreds of times. You start at a level of 12, take 10,000 units in tablets, and it goes to 15. Very frustrating, right? You wasted several months waiting for your vitamin, hoping your vitamin D would go up, and it doesn't go up at all or just a little bit. So most times I've seen tablets not do the trick, not get the job done. So oil-based gel caps, available, inexpensive, and they work consistently. Tablets rarely ever work. Droplets, I only advocate use of droplets for like children, or if you can't swallow little gel caps, but they're really pretty small. But the droplets have a problem in generating very erratic blood levels. I think it's because of variation in the droplet size. So if you're going to use a droplet, say for a baby, you want to be as consistent as possible in generating the same size droplet, or else you can get wild variation in blood levels. Now, what should your dose be? Well, the average needed for an adult is about 5,000 to 6,000 units per day. But once again, you want to check that blood level in a few months if you really want to be sure. The problem is there's many factors that vary that cause you to have different needs than other people. If you're overweight, the need might be as much as twice as much as a slender person. That's because fat tissue sequesters, holds on to vitamin D. And likewise, when you lose weight, you may need less vitamin D because you're releasing that stored vitamin D. There are genetic factors that play into your need for vitamin D. Some people need only 1,000 units. Some people need 20,000 units. Dark-skinned people tend to need more vitamin D to achieve that same target blood level. Age plays into it. The older you get, right, because you're getting less activation of vitamin D in the skin, the more you'll have to take in orally. Along with the genetic variants, one of the clear-cut genetic variants that determines a greater need for vitamin D is the presence of a condition called aortic valve stenosis. Not the congenital kind, but the kind you acquire in your late 60s and 70s, so-called tri-leaflet aortic valve, where the aortic valve, one of the main heart valves, is supposed to open and close. There's 3 leaflets, looks like a pie cut in 3 pieces, and those leaflets become stiff and accumulate calcium. Well, vitamin D, in the majority, puts a stop to that. But in those people who have aortic valve stenosis or aortic valve sclerosis that precedes stenosis, stenosis means it's not opening, sclerosis is just getting hard. People prone to aortic valve disease appear to have a much greater need for vitamin D. And that may be part of their susceptibility to calcium deposition on the aortic valve. So you may find that, for instance, if you were told, let's say at age 67, you have an aortic valve murmur, and your 25 hydroxy vitamin D blood level is 14, you put yourself on a good dose, 10,000 unit oil-based gel cap, right? And you check a level, 38. Go up to maybe 16,000. So this seems to be very specific to aortic valve, people with aortic valve disease. So those are some timing issues because it's so darned important to get your vitamin D right. Now, if you want to see how vitamin D fits into the context of a broader program, the best place to see where my programs are nowadays is to get my the newest book, which is the Wheat Belly Revised and Expanded Edition, where I talk about vitamin D and how we use magnesium, how we try to recultivate a healthy microbiome, a bowel flora program, what the diet looks like, and other strategies. It also gives you the why, the rationale, and the science for why this works, and why when we put all the strategies together in my programs, why we get this wonderful and powerful synergy among all these strategies.